Welcome, everyone. Thank you for joining us this morning. My name is Cindy Harrington, and I use she, her pronouns. I'm a project coordinator for the Community Hub here at Northtown ACH, and I'm one of the facilitators for this network learning session. Today, we'll be exploring the role of community health workers in promoting health and strengthening our communities. We have a fantastic group of community health workers here with us today who will be sharing their knowledge and experience and commitment. Thank you, Michelle, Katherine, Daniela, for taking the time to be here with us and to teach us more about the work that you do. Next slide, I think it's the land acknowledgement. Perfect. I'll read it to acknowledge the land where we are today. We began with humility, we began by acknowledging with humility that the land where we are today is a territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. Thank you. Just a couple of reminders. This session will go from 10 to 12, so we have about 2 hours together. We don't have any scheduled breaks, so feel free to take mini breaks through that as needed. Also, feel free to use the chat throughout the learning session for questions and sharing resources. If possible, please keep your cameras on, but no pressure. Lastly, the session is being recorded, and our presentation team will be sending over links throughout the session. We'll be using Mentimeter and sharing resources towards the end. And Mario, over to you to start us off with our agenda for today. Thank you.
Awesome. Thank you, Cindy, for that great introduction and for the land acknowledgement. Hello, everyone. My name is Mario Bañuelos. Pronouns are he, him, his. And thank you so much for being here in this great event, sure to be a great learning opportunity for all of us. And this is an event that's brought to us as an added value of being part of the Northtown ACH Collaborative Action Network. And so we want to be able to be thankful for that we get to learn so much in these different events and learning collaboratives. So today's agenda, we will be talking, or we will be learning about really four specific goals. And that is how to grow our understanding of the role and impact of community health workers and explore opportunities to employees and engage community health workers, how employers can engage community health workers in what they do, and also grow our understanding of the barriers that community health workers face in their role and some opportunities where we can support. Also, looking forward to the next generation of community-centered, equity-oriented work. Again, the network is a learning, advocacy, and collaborative action network that is open to all community members and organizations. And thank you for being here. So what are community health workers? Let's go ahead and start some of this learning process. There's one of my great colleagues is going to put a link in the chat box for Mentimeter, and actually this is it here as well. And if you know how you go to www.menti.com and you enter that code, you can also scan your QR code if you're on your phone, or rather if you can scan. And let's answer this question. When you think about a community health worker, what are some words that come to mind? What is a community health worker? So now we're going to go ahead and take a look at here and see what are your thoughts when you think of community health worker. So I see a lot of things here. Community health worker is someone who is the barrier between a patient and a provider. True. A medical professional who meets community members where they are to provide health services and or referrals and resources to other services. Yes. someone who works for the community to improve the health and safety of the community, a navigator, educator, and so many other things. And so this is great. These are all someone put on their church. Yes. Navigator, liaison support to families, trusted messengers, very true. Frontline staff member addressing community issues in real time. Wonderful person who helps community members connect to services. Yes. Someone who helps individuals that are struggling. True. Trusted caretaker, trusted messengers. All of these are true. So I appreciate that there's already a good understanding of all these different things that community health workers do and what the community health worker umbrella that includes a lot of people and different roles and different titles. So when we think of the community health worker umbrella, who are they? What do they do? So these are some of the names of community health workers, some of the roles and names that you might find out there. Some of them might be parent liaisons, community health representatives, outreach coordinators, promotoras, promotores de salud, health advocates, community health worker or community health worker umbrella, community navigator, peer educator, early intervention specialist, and so many more. And so we use the community health worker or promotora de salud umbrella to really encompass all of these different roles that community health workers do. And so what is a community health worker? And as you put in the Mentimeter, community health workers are trusted messengers, are people that are in the community that do provide services, that connect people to resources, that provide things in a culturally relevant way. And we'll go through a little bit of a video here a little bit, but I did want to talk a little bit about how we're moving from the social determinants of health to the vital conditions. And as a reminder, those of us that are here in the Collaborative Action Network, you know, the North Sound, and the Collaborative Action Network, we're focusing, moving from social determinants of health to the 7 vital conditions. And those 7 vital conditions are those things that move us to health and well-being and success of individuals. And that is, of course, having humane housing, meaningful work and wealth, food security, healthcare, transportation, lifelong learning, and of course, belonging and civic muscle. Once all these other conditions are met, then we're able to move into that. And so just kind of to framing that community health workers work on all of these things in order to make sure that the health and well-being of the individual and the community is there. And that also includes community health workers ourselves, and how do we create those vital conditions for ourselves in order to provide services and connect people to health and well-being as well. I'd like to state that because community health workers ourselves are starting out now where maybe medical assistants were about 15, 20 years ago. Before, medical assistants wasn't a profession. You would just say, you know, what's a medical assistant? Well, I don't know. But it started to develop, and now there is a profession of medical assistants. You have to go to school. You have to not necessarily get a certification, but you do have to get training in order to be a medical assistant. And so I think we are at that point now of developing that community health work into profession. And what is it that we do? What is the scope? What is the definition amongst ourselves of what we do? Because we've seen so many different definitions or titles, and everything's a little bit different. So what are the different definitions that we have? The Washington Department of Health tells us that community health workers play a critical role in the health of their communities, linking diverse and underserved populations to health and social service systems based on their life experiences and roles as health influencers within their communities. Community health workers work to reduce social and racial disparities in healthcare. Community health workers can improve health outcomes and the quality of care while achieving significant cost savings. And the National Association of Community Health Workers, NACHWA, tells us the definition is a community health worker is the frontline public health worker who is a trusted member of and/or has an unusually close understanding of the community served. And there's a longer definition of that, but we're summarizing here. And then there's also the C3 project. The C3 project is an undertaking of also at a national level of different community health worker experts that are, their definition is community CHWs, also known as promotores or promotoras de salud, community health community health representatives and peer educators, among many names, work throughout the US to achieve health equity. CHWs increase understanding among other professionals about the effects of social determinants of health on patients' lives and their care, and also support individuals and communities in addressing those determinants. And so what is a community health worker? What are their roles? What are their competencies? Here's a little bit of a video that we'd like to share with you that talks about, that's from our friends at C3 Project, that we'd like, that kind of puts it well what a community health worker is. So let's take a look at that.
What is a community health worker? Who are they? What do they do, and how do they do it? Are they outreach workers, peer educators, promotores de salud, even tribally based community health representatives? There seem to be so many diverse names. Those names reflect the diversity of the CHW field and mirror the many distinct settings and communities where CHWs serve. Are there paid CHWs and other CHWs who get stipends or even volunteer? Well, mostly CHWs are paid. Hopefully, they are paid a good living wage with benefits. Some CHWs volunteer, some because there is still limited stable funding for CHWs, and some volunteer because they want to give their time to their community. Even with all these differences among CHWs, hopefully you know a lot about what CHWs have in common. One thing you should know is that even if CHWs are not all paid or not all paid the same, CHWs are deeply committed to supporting the individuals and families where they live and work. They are part of a continuum of caring. Another important thing that CHWs share in common is their core roles and competencies, including their skills and qualities. Many people have looked to the 1998 National Community Health Advisor Study for a starting point. The study identified 7 core roles, which help define CHW's scope of practice. These roles include cultural mediation, health education, assuring access to health care and other services, informal counseling and social support, individual and community advocacy, provision of direct services, meaning health screenings and basic first aid, and individual and community capacity building to strengthen and support the skills and abilities of individuals and communities. Programs and policies to support CHW service development should ideally position community health workers to fulfill a wide range of their core roles. What happens if CHW roles are too narrowly defined? Let's take a look at what happens when a CHW works in a narrowly defined role. If a CHW teaches Diabetes 101 in a classroom but does not have the opportunity to talk with those attending the session, she cannot offer social support. Given this narrow role of health educator, the CHW might not touch the lives of those she serves, and the participants might once again be overwhelmed with the medical information about their chronic condition. They will miss the benefit of an informed ally who they can talk to about the changes they want to make and how hard it is to make them. Their condition is poorly controlled, and they may find themselves in the emergency room once again. If we want community health workers to carry out a wide variety of roles within the community, we need to make sure their training gives them the right skills. Dr. Noelle Wiggins, who led the examination of roles and competencies for the National Community Health Advisor Study, identifies 8 core skills that CHWs need, including communication skills, interpersonal skills, service coordination skills, capacity building skills, advocacy skills, teaching skills including facilitation, organizational skills including setting goals, planning, documenting, and research, and a general knowledge base including knowledge about the community, specific health issues, and health and social service systems. The study also found that CHWs have many important qualities, the most unique and important of which is that CHWs are closely connected to the community they serve, sharing life experience. You may wonder whether these roles and competencies represent today's reality for CHWs as they did more than 16 years ago when the National Community Health Advisor Study was released. That is the purpose of the National Community.
Well, thank you for sharing that. That brings us a little bit more information as to, puts it well, what community health workers do in general, and more resources will be coming later on about that. I just wanted to tell you a little bit more about me and why I became a community health worker and why I'm interested in all this community health work. I'll just take a couple of minutes to say that I did not know I was a community health worker until 6 years ago, when I went ahead and took the Department of Health, Washington Department of Health Community Health Worker training, and I actually was invited to go to Wenatchee to a convention about community health work, and that's through taking the training. Then I found out, wow, I've been doing community health work for the past 20 years, and so I really appreciate community health workers and what they do in the community, and the special type of person that it takes. Now I'm all about community health work. I'm involved in the Whatcom Community Health Worker Network Leadership Committee, founding the Washington State Community Health Worker Association, also part of the American Public Health Association's section on CHW's Training and Education Committee at the national level, and also the Department of Health CHW Leadership Committee, which is made up of 23 plus CHW experts across the state, colleagues, really great people. And also at the national level, part of the NACHWA Medicaid reimbursement, the National Association of Community Health Workers Medicaid reimbursement work group. And also at Empower Next Generations, where I serve, we both hire and advocate for community health workers in our organization, particularly those that are indigenous language speakers, like Mixteco, Zapoteco, Nahuatl, etc. And so I'm all about community health work, and I just love this topic, and I'm really excited for everyone to be here. But I'm really more excited to hear from our awesome panelists that are really passionate about this work, that are doing this great work. And Cindy, can you take us through with our awesome group of panelists here?
Yeah, thank you, Mario. At this time, we'll get started with introducing our three panelists. Again, thank you for being here today. Starting with Michelle. Please share your name, organization, and give us an overview of your role and its impact on the community you serve. Sorry, one second.
I unmuted myself. Sorry about that. My name is Michelle Di Miscio. I work at the Department of Health. I work within the Community Health Worker Training Program, and I work within the section called Community Workforce and Partnerships. I am the manager for the Community Health Worker Training Program. My role is not just to manage the program. My actual role is to support, elevate, and usher in all types of CHWs, promotoras de salud, or of the community, so that you have a space where you can get equipped. Your life story, your lived experience is what equips you, but bridging into the spaces you might want to work in requires a little bit more equipping. And so it's the paperwork, it's all of that. It's the ways to bridge to supervisors and to management and to admin. It's the behind the scenes work that you do that requires a little bit more support. So that's the nature of the Community Health Worker Training Program, essentially, is to support and equip and create learning opportunities that are actually more than what we used to be doing, because the Community Health Worker Training Program came around in 2011. and it is now 2023. There's a lot of changes to create, and we're proud to listen to community health workers, to learn from you all what those changes ought to be. So that's my role, my actual role.
Awesome. Thank you, Michelle. Taking the CHW course with you this year was great, and we had a lot of good conversations. Thank you for the introduction. Katherine, over to you. Sorry, let me repeat the question. Please share your name, organization, and give us a little overview of your role and its impact on the community you serve.
Yes, good morning, everybody. My name is Katherine Romero, and my ancestral name is Tisvaro Wich-Talem. And I just want to take a minute or a second to thank you for the land acknowledgement, and thank you all for your time and your hearts here today. I recently joined the Northwest Regional Council in April, so I'm fairly new to my position here as the Tribal Program Specialist. And I am currently working on developing a tribally focused caregiver training program for family caregivers who are caring for family members with dementia or brain health challenges. I am also responsible for building and strengthening relationships between the Northwest Regional Council and the 6 tribes here in our area in Whatcom and Skagit counties, and linking them with resources and closing that gap between the tribes and Northwest Regional Council. I also want to share that I'm currently working on my doctorate degree in public administration, with my research currently focused on dementia and brain care in tribal communities. So I'm happy to be here. Thank you for having me.
Thank you, Katherine, for sharing your insight and your expertise. Daniela, please introduce yourself and let us where or which organization you're coming from.
Okay. Hello, everyone. My name is Daniela Pereira. My pronouns are she, her, hers. I work as a community bilingual support specialist in the Orcas Community Resource Center in Orcas Island. We have a variety of programs here at the Resource Center. Our mission is to make sure that our community members have the basic needs to live a thriving life. My role in the organization is to make sure that the Spanish community have the vital conditions and the minimum or maximum requirements to have a thriving life. My role, a lot of my role in the Community Resource Center is medical care coordination. We do a lot of connecting people to primary care doctors, transportation, financial assistance applications. We also have a program here at the Resource Center. Thank you to the San Juan County and Peace Health in Friday Harbor. We got telehealth program is called the Lean Health Program. And this program is able to connect people that is underinsured to first care providers and people that doesn't qualify for health insurance in order to treat their health. So that's a lot of what we do here.
Thank you, Daniela. I think the second question is going to be Mario.
Yeah, thank you, Cindy, and thank you to all our awesome panelists. I really appreciate you being here and all the wisdom that you bring. And to kick us off, I'd like to ask you, community health work or community CHW means a lot of things in different workplaces, in different sectors. How do you define community health work? And if you could give us an example of what that looks like to you.
For me, community health worker is the person that help people with barriers to get access to healthcare. So in our community, we are a small percentage of minorities. We have a lot of people that have lived here for 20 plus years. They don't have access to healthcare, and they have a lot of barriers like language barrier. And they have the barrier that they don't qualify for health insurance, or they don't have the money to access to healthcare. In Washington State, 87% of the population, Spanish-speaking population that is undocumented, does not have health insurance. The key barriers to obtain health insurance are lack of eligibility due to immigration status, which is 62% of that population, and then the high cost is 46% of that. The key barriers to accessing need healthcare services are the lack of health insurance and the high cost. You know, people can access to stuff like dental care, primary and preventive care, vision and care, prescription medications, reproductive health, and things that we all need in order to have the healthcare. So one of our missions and what we do here at the Resource Center with different programs and partnerships we have is helping to our clients to access to those services with not that much barriers. So they came here and we tell them, you can go here. We make sure that they connect with the doctors. We make sure that they have transportation to get there. And then we follow up and make sure that the outcome or this previous job is access to healthcare, and eventually people get better.
Daniela, I love that. How you defined all that with the actual work you do.
How do I define that?
No, I said I loved how you defined that by the actual work you do.
Thank you. Yeah.
Absolutely. I would say for me too, community is the word that is just the right, the word that it speaks to me. If you're going to ask for a definition of community health workers, for me, that means staying embedded, like closely with my community. I live in South Park, and that's a big portion of my Latino community lives. I worked in housing access for creating housing after gentrification, during gentrification here in South Park, because our Latino community was 10 up in little apartments. And so being able to speak with my neighbors and know the conditions in which are not vital that they're living and trying to access new ways to gain housing. So always some level of volunteer spirit, and it doesn't have to be volunteer. It's just some of the most innovative work is not happening yet. So you go out there to pioneer it and no one's paying for it. So you're volunteering. And gathering people and organizing is something that is pivotal. It makes things happen because people need people, and people need to share their experiences. And then those with other resources need to hear those experiences. So for me, community health work did start from my own lived experience as a child and extended into a unconscious personal quest to make a difference based on 2 family members and my experience with them, and wanting no one to be isolated in pain or in suffering, lack of knowledge, and that we as community get to shore up and surround the people we love, the community members we love, to make sure that they thrive and never, ever feel alone. So that's like a definition.
I personally would like to say that I've been doing this job for 3 years. And for me, what is the most rewarding feeling is when I have some of my clients that came here and say, Daniela, we just wanted to let you know that you're an angel and we love you, because before you came here, we did not exist. We didn't have anyone that helped us with anything. I have certain of my clients that have 2 or 3 chronic conditions and they didn't have health insurance, and they didn't speak English, and they didn't know, this is, I had a client since 2008. She have a lot of medical problems. She struggled a lot. She have a big family, and she didn't know how to navigate the health system. She didn't know how to pay, so she was huge in that. She didn't know how to like be healthy, and sometimes you're sick and you want to go to the doctor and you have to pay, and that gives you more stress because you're not really like, you're trying to get better, and getting better is not easy or is not accessible. So I feel like for me, the community health worker position or the community health worker work is more about talking to people about prevention. Okay, you have diabetes. How do you gonna make your diabetes to get better? Or you have obesity. How do you gonna make your obesity to go away? Do you have like a meal plan? Do you have, how do you gonna make that your problem that is already there goes away? Or how do you gonna make that how do you gonna make sure that you don't have that a health problem in the future? So that's what the definition, my own definition is like, you care, like the Hispanic community, we are, me personally, we are raised in a way that we care about others more than ourselves. So if you have kids, you go to work, you take care of your kid, you make money, you make sure that your kids are in a school, are fed, have all their needs, your husband have the hot food in the table, and then you forget about yourself. So for me, the principal role of a community health worker is making sure that the people don't forget about their own health and their own needs.
Absolutely. Thank you, Daniela and Michelle.
For me, well, community health workers looks like so many things, but today I wanted to kind of bring some attention to community health workers in tribal communities. And they are usually family members who are taking on the role, a traditional role as a caregiver for their elders. More often than not, it is the children, the grandchildren, the nieces and the nephews who become caregivers for our tribal elders, and providing care as a community health worker in this manner looks like a lot of different things. They're often, my role for my grandmas and my elders in my tribal community, I'm often a counselor or a listening ear for elderly who just want to be heard and want to share as much wisdom as they can. We're often advocates for resources that they need, services that they need, medical and financial advocates as well, chore workers because they're not able to do a lot of the physical things for themselves that they used to do, medication management, making sure they're taking their medication, and also helping them understand what the medication is for, and understanding their medical conditions and the symptoms that come with them, and how we can manage that on a daily basis to ensure that they're having a good quality of life every day, that they are still living a good life with their illness or their medical condition that they have. We're often running errands, running to the store, getting them what they need, or yeah, just that it just looks like we don't consider ourselves health workers because it's such a traditional role that's been passed down for generations, that it's our responsibility, our sacred responsibility to take care of our loved ones. And also community health workers are also those who are learning, educating themselves on information and knowledge that's out there to provide better quality services, the ones doing research to provide information needed to develop policies and programs to implement more supports to the families and the communities and the healthcare providers and the tribal leadership for our elder programs and healthcare programs, you know, enhancing those programs that will continue to honor our tribal elders and the wisdom and the dignity that they have to share, you know, for as long as we possibly can. There's a lot of statistics out there now that are showing that our tribal elders are going to live longer, and that longevity is going to continue to increase over the next 30 years from what we can tell. And how are we preparing for that? How are we preparing to care for them as we start to see more illnesses and challenges, especially in dementia, Alzheimer's, things that we haven't seen before because our tribal elders were not living long enough for us to see it or experience it. And so I'm hoping to be able to bring forward more insight, information, and knowledge in that area to help our tribal communities prepare. And tribal communities, I mean, as a whole, as tribal leadership, healthcare providers, our elders programs, and especially the family members who are providing the care, getting them the training they need to best care for their elderly.
Wow, thank you so much for that. Thank you for sharing, you know, all the different resources and materials that you bring to community, and that part of also learning about what's out there and training yourself on how to provide those resources also to community, because that's important as being a community health worker, being on the pulse of what's available and how to connect people, and this sense of treating people with dignity and respect and honoring their value as a human being, and being able to really care for and think about what are the ways that we can help in the future, because new things are happening with climate change, with different substances, with different medications in our waters, in our earth, all these different things that we also need to think about. So I appreciate you sharing in that resources. And Cindy, we have another question for you.
Yeah, our second question is, what are some barriers or challenges that community health workers face in their role?
I've witnessed all kinds of stuff. I think for those who use an ITIN number, it's certain agencies may be protecting themselves as an organization and requesting people be contractors, which is hard because then you work project by project, can't make over a certain amount of money. And it's like impossible to have a sustainable living wage. For those who are on the flip side of that coin, are citizens of the US and can work. I guess I see, and in both spaces, but especially in the ITIN space, let's say, some dreams of collective ways of working that are really respectful, but then not being able to work that way. And even some of the best and smallest community-based organizations, because there's a level of disrespect or ways of talking to CHW's promotoras that are minimizing, yeah, and that's just not a growth zone. It's not healthy. It's aggression or microaggression. And so I've seen that, and I've seen whole groups of promotoras leave certain organizations to be free and then go ahead and do contract work anyway, because they're still not free. Then we have, I think, the challenge of role clarity in some of the agencies who are just newly hiring CHWs, and the new clinics or clinics that are newly hiring CHWs aren't clear how to actually respect the role, honor the work, and ensure a safe nest where that CHW can be nourished continually, where they have a voice, where they can share the client, if you will, community member stories, so that there is continual improvement and iteratively. And I think that's really dangerous. And so role clarity again. And then honestly, I think racism, period. And so I know it's been changing over the decades. Even Yakima is different than what it was, but guess what? If you go and ask CHWs and community members, the structures have not changed. So you see the pain of some medical interpreters, some community health workers, and some like totally leadership community members having to complain that the clinic disrespects them, that the clinic, there's no place to complain, that so how do you get healthcare? How do you get real access? And then top that off with what I think Katherine in her tribal community and has been able to uphold, and it's not being upheld because of racism in spaces like the whole central part of Washington. And it's describe it, it's where you have our intergenerational families living together. You have a teen, babies, a mom and dad maybe, and grandparents are being shunted to the side, neglected. And they can't go anywhere in the central part of Washington to be sort of seen, a part of society for their own community, because like community centers don't speak they don't have anyone that speaks Spanish, and there's no way to create new nesting for families even in society. So that's kind of layers and layers and layers and layers.
Thank you for sharing, Michelle. Katherine or Daniela, do you have anything to say about some of the barriers you face in your work?
Yeah, so I think there are so many challenges and barriers that we could talk about for hours, with politics and community challenges, et cetera. But for today, and as far as family caregivers, one of the biggest barriers and challenges are funding for caregivers. There just isn't enough funding to pay caregivers a livable wage. Family caregivers are often unpaid, which causes a lot of challenges for the caregiver because they have bills to pay too, and families to take care of too. So providing care becomes a coordinated effort among other family members and community members. And some tribal elders just don't have the family or community members to provide that unpaid caregiving for them. And then training for the family caregivers is another barrier or challenge that we face. And one of the things I'm working on now is a caregiver program that is tribally focused that will help get our caregivers the training they need. And lack of programs and resources for caregivers is a great challenge. And the low income guidelines create barriers for our tribal elders to access resources. Those are the challenges I can think of off the top of my head.
Thank you for sharing.
I think one of the barriers that community health workers are people that is working in the front lines experience is the frustration of wanting to help people, but they're not outcome in the way that you want it to be. So for me personally, one of my biggest frustrations is when I call the hospitals, the clinics, and I speak with the people and they say, I'm sending this client needs this and this and this. And they go, and when they go there, they're actually being treated different. So like how they speak with me on the phone, how like the connection and communication work with me is different than how it worked with the participant or the client of the program. It hurt their feelings. It hurt their feelings to feel that they don't matter. It hurt their feelings to know or feel that, you know, if you're sick, that's not our problem. You're brown, you're not American, you don't have any paperwork, you don't have any money to pay. So why would we care? Why would we put all this effort and time into you when you're not really like the rest of same as other people? That's frustrating for the client, and that's frustrating for the community health worker or the person that is doing all this job, putting all this time, putting all this commitment and you know, like passion of trying to do better for their communities. But this doesn't matter how much you do, if the system is not helping, then it's very frustrating.
Right. Thank you, Daniela. I believe we have one more question for you three. Mario, go ahead.
Yeah, and really thank you for just touching the surface on some of the barriers that are out there. There's definitely a lot of different barriers that CHWs face, and we face them daily. And another thing that also that we face is also burnout, because you do this work so much, and then at some point we need to also take care of ourselves and be able to take some time aside, because burnout is real throughout everywhere. We've gone through a pandemic, we've gone through a lot of changes, we've gone through a lot these past years. But CHWs, we sense that urgency of helping people more than we help ourselves. And so we need to take some time also on the burnout part to take some care of ourselves and be able to slow down and be able to also do some self-care along those things. So that's also another barrier, that at some point we just hit that limit of we need to take care of ourselves in order to take care of others. Kind of that analogy of the, you know, the child with the putting the face mask on yourself first when you're in an airplane, and then on the child, which doesn't make sense, of course, put it on the child, but first you have to be able to take care of yourself so you can take care of the child. So burnout is real. Many of the barriers that we face. So this other question, what have you experienced or seen as best practices or positive impact as a community health worker? How can the role of CHW advance the equitable well-being? How have you seen some best practices and positive impact in community health work?
I think community health workers are being more recognized and acknowledged more than I've seen in the past, but I haven't been here for very long. There's so many task force and committees and groups that are bringing more awareness and education out to organizations and communities and decision makers. And there's a lot of progressive work that's being done. And I've noticed it's a lot more inclusive now, and inclusive in a way that advances equitable and accountable healthcare for all communities and all of us who are living together here. So those are some things I've seen and experienced in the last several months that I've been here with Northwest Regional Council.
That's good. That's great. Totally agree.
May I agree with that, Katherine? And just share that I think during COVID, it was recognized the amount of community leadership that this work takes, and that communities came to the fore, and they weren't they were going to learn ahead. They were going to get their hands on what they needed. And then the community-based organizations serving those communities acted like leaders, went out and got it and brought it to their workers, the ones embedded in community, delivered it. And then we had innovators taking leadership and doing things different and calling upon the systems to say, hello, we need this, we need that. And some systems responding like public health. Even, there were glitches in training, and part of that glitch was asking for a social security number to get a vaccine. Really? And you go to that clinic serves you. You have a clinic card, but you need a social security number now. Why? Because all of a sudden a vaccine became like scarce, or only certain people can have it. But it was sort of a bias. It was just a bias in the people allowing for the vaccine to happen that day. And it has to get untrained or trained out those biases. So I think that kind of amazing leadership where promotoras de la comunidad and CHWs and across the state said, we're not going down like this, and we're going to get everything we need. We're going to ask for it. We're going to go get vaccinated so we can teach about vaccinations to our community and be out there still with masks and distancing, but teaching and virtually. And so our communities who never would have wanted to try to do virtual nada learned. And now it's like an access point, and it's still a learning. So I think that we've changed what best practices mean to us, and we've had networks like you all have the North Sound ACH, and we have Whatcom CHW network, and I get to volunteer with the Latinx Health Board, and that's the network I'm very connected to in order to make things happen and juggle it up and elevate up and out. And I think you're right, Katherine, those lines of communication are changing and we're a little bit more unified. I think there could be more cross collaboration so that we can really ally with each other in new ways to support each other's work. Cross anything, cross racially, cross ethnically, cross language, cross cisgender, trans, I mean, just really mix it up and support each other in new ways. But I think you're right.
Awesome, thank you for that. Daniela, your thoughts?
Daniela, you're on mute.
Yeah, I continue what Michelle was talking about. It's also a lot of fear from the communities. And I personally I've been doing this job for 3 years, and I'm getting to connect with my community after 3 years of working with them. Because I'm under an organization, and even when I'm an immigrant, and even when I speak Spanish, and even when I'm an equal, they don't see me as an equal. They see me as, you are sitting in the desk behind this office, and I am different than you, and I don't trust you. So I feel like the trust part is a lot of work that community health workers have to do in order to be able to actually connect in the proper way with your community. I feel like at this point, after 2-3 years of, talking to the same people, asking how your kids are doing, how your husband is doing, I finally get to have a connection with them in a way that now is actually, they don't see me as somebody behind a desk from an organization. They see me as a friend. They see me as an ally. They see me as somebody that they can trust. Our community is really small, so people is always afraid to talk about their struggles or what they're going through, because they say, oh, if I tell you, you will tell Juanita, and Juanita will tell Peresanito, and Peresanito will make a whole deal, and I don't want anybody to know what I'm going through. I don't want people to know that I'm struggling. That is really heartbreaking and sad, because it's like you are stopping yourself to ask for the help you need because you don't feel enough trust to communicate with your community. And I discovered that here with the Hispanic community. You know, they've been living here for 25 years, 30 years, people from El Salvador, from Mexico, from Guatemala, and they like all different countries in a really, really small community. The unification is so hard because people is stuck in this idea that somebody's jealous that I'm doing this, so I'm not gonna say anything. Or somebody, if I'm sick and people know I'm sick, they will treat me different. So I'm not gonna say to anyone that I'm sick because then everybody will know and I will be rejected. So those kind of situations for me, as a person that works with the community, I speak a lot about how you can take these people that is next to you and take the similarities that they have with you and grow together. So I tell all our clients in here at the Resource Center, all my clients from the Spanish speaking countries and the Spanish speaking community, I speak with them individually about, hey, it's nobody against you. We can make this work. This is you have been living in here for 20 years with these people. Let's gonna create trust. Let's gonna create sisterhood, or a way to help each other and support each other, to all of us be happy. Like, we have so many things in common and we're so separated that we don't understand that the only thing that unify can bring is success, the health, and all the vital conditions. I mean, if I have no house and I know 20 people and I tell 20 people I have no house, it's probably more likely that I will find house after 20 people know and 20 people care about me. That's a lot of the work that I think a community health worker, more than prevention of health, more than like community connections, it is super important. It's a super important job that community health workers do.
Yeah, no, I really appreciate that. This sense that at the core that a community health worker is a trusted messenger, and that they are an ally with you in getting into these 7 vital conditions for your success, and also treating you with dignity and respect in a culturally relevant way, because you're embedded in the community, but having that trusting relationship that you're building over time because you live in the community, and also you keep things amongst the, the conversation is amongst us. You don't go out and tell people, oh, so and so did this, or so and so did that, or they're sick. It's a trusted relationship where you can talk frankly and move forward on things to get better and to have those conditions for success and well-being. And that's something that sometimes at healthcare settings, it's a 15-minute appointment, it's a 30-minute procedure, it's a 45-minute procedure, and you have this lifelong condition that you're working with, and there's not enough time to really get down to how do we plan to get better? What are my options here? What are my choices? How do we, what else is going on? I also don't have transportation to get to the clinic. I also don't understand the doctor, the provider, when they're talking in high-level language. I don't know what those words are, or I'm new here and I don't know how to connect to resources. And community health workers are that trusted messenger that are able to go ahead and connect to people on a real level. And I appreciate all that you have brought forward to us. And just to move us forward into some more learning, a little bit deeper learning, I do see a lot of questions in the chat box. And so that's some of the things that we're going to touch on in this group discussion. And we're going to talk about that in a little bit. So Cindy?
Yes, thank you. Thank you, Michelle and Daniela and Katherine, again, for your commitment to our communities and for letting us, be here in this space. For the breakout session, as we wrap up our panel, we're gonna be in a group of 4 to 5 And you will have 15 minutes to take a moment to think about what you learned from our panelists' experience and the impact that they make in our communities. This will give you an opportunity for you to reflect amongst each other what you learned from our 3 panelists. Once you're with your group, go ahead and introduce yourselves and reflect on these 2 questions. What did you find most important or valuable about the role of the community health workers? And share one key takeaway or insight you gained from the panelists' experience and their impact on communities. And we'll come back in 15 minutes or so as a larger group to share what folks discussed. Welcome back, everyone. Thanks for participating in the breakout rooms.
Welcome back. So I heard you had some great discussions and a lot of great conversation, a lot of great learning. Share with us, what did you find most important or valuable about the role of CHWs? Who would like to share out?
Well, I'll jump in. We talked a lot about relationship and relationship building. Just like how community health workers build their own networks of people that they trust, that they feel like they can call upon. And we spent quite a bit of time, just kind of really just so grateful for the panel and some of the stories about how the system doesn't always see us, hear us, recognize us, treat us well, and the opportunity that this workforce has to make such a huge difference. So those are some of the things from our group.
Thank you for sharing.
I could share from our group a little bit from room 4. We also talked about kind of that relationship building and that aspect of that work. And I'm, pulling from experience from my previous job where it was a lot of direct service. But I think one thing, and this was mentioned farther up in the chat, I think Daniel said this, is that relationship building, it can take a lot of time, and it's not always something that's, from like a top-down perspective, something that's measurable. Where my previous role, we're talking like, how many housing intakes did you do? How many referrals did you make? That kind of thing. But we're not really looking from a funder level at like, how many people did you build trust with, or like kind of create engagement with the system and build relationships with. And that's, something I think that can get lost in that kind of top down, as those priorities are some work there maybe to shift priorities a little bit. Yeah.
Awesome. Thank you for sharing that. So important, so vital in being able to work, collaborate with people where they are. And thank you.
This is Devin from group 4. Oh, sorry, go ahead.
No, are we doing raise hands, or we're just doing this popcorn style? I'm just curious.
Yeah, you raised your hand. Go ahead.
Yep.
Devin, you can go right ahead since you had already started speaking. I'll go after.
Sorry, I will try to be super quick. So in room 4, we were talking about points of friction. Where's the line between becoming one of them as community health workers, perceptions of both the community you're trying to serve and the healthcare community. Talked a little bit about, as a nurse practitioner, like what are the key things that are important for me is that the patient understands like discharge instructions and medication instructions, but on the time constraints, there's just not always enough time. And so utilizing and making more visible community health workers in the healthcare setting, and training some of us on like who these people are and why they're vital to us. So yeah, we talked about a lot of different stuff, but exciting discussion.
Awesome. Thank you.
Excuse me. First off, great sharing. I was in the middle of saying something and I always get cut off in that breakout room. But just to finish off my thought to the rest of the group, and Devin, please don't apologize, like no worries. So for me, a lot of the conversation was around contracting, like why are they contractors, right? And like why specifically is that like a pathway for folks, and why is that? And also it's like, technically here at CHS, we have a lot of folks who fit that bill of community health worker, but we don't call them community health workers. It's almost like inadvertently, because we are trying to be really intentional about hiring for lived experience, like really elevating that lived experience as an important aspect of being able to do your job or whatever you're applying for. Maybe inadvertently, we've been creating folks who can act in some way, shape, or form as community health workers and as those bridges, and have that flexibility to act as needed to serve our communities. Because again, CHS is kind of like we have a lot of different hands in a lot of different pots. So that was something really interesting. Are we already doing this in our organization? We just don't realize it. We just haven't labeled our staff as such. And then we got into the whole conversation about, we got a whole conversation about the contracting. It's like, why? I don't believe that it is fair. It's absolutely unfair. I'm just going to go ahead and say it. It's absolutely unfair that these folks who are coming in here and bridging that gap are so inadequately paid. Number one, inadequately paid, inadequately supported in benefits and health benefits and XYZ, right? And also for me, I'm going to sound like a broken record for folks who know me, it's re-traumatization. Like we expect these folks with like extensive lived experience with their own traumas to go out there and talk to other people about their traumas, and then we don't support them in their own healing. It is toxic. It is something that's toxic in the human services industry, in the nonprofit industry, and that requires actual systemic change. So I'm just going to get off my soapbox for that aspect. But the contracting thing, I think one of the interesting there are a lot of like the legal stuff, why folks would be contracted depending on the organization, depending on the system. But also the flip side of that is like not every situation where someone is contracted as a CHW is necessarily to their disbenefit. I don't even think that's the right word. It's like sometimes it's to their benefit. Perhaps they have settled, not settled, but like there's an agreement between them and the organization to be like, I can only work X amount so that I can continue to receive X benefits. Or I've already been volunteering with you, doing the work. You want to bring me into your organization in a way that's like, that allows me to continue doing what I'm already doing. It's not black and white. There's a really big, it's a big gray area. It's not all good and it's not all bad. And I think that the only way, well, I can't say only, I'm not a definitive kind of person, but one of the best ways we can actually ensure the CHWs are getting what they need in terms of being supported as honestly, as a profession that's beginning to rise up is an overarching governing body. Like if there's structures, if there's actually someone we can hold accountable as a larger entity, as opposed to leaving it per organization, then we can actually set structures to be like, no, this is how they should be treated. This is how we're doing this. This is how we're doing X, Y, Z. So like, and again, balancing that with the fact that a lot of folks are coming from communities that don't necessarily, if you're undocumented, you'd have Social Security. So it's finding that balance. So I wonder, and here's a bigger question, if we continue to elevate CHW specifically, like we have to address a lot of other systemic inequities as well, such as passive citizenship, how we support our folks. It's like, it's multi-layered. And I think that we do the industry that's emerging at a service if we don't look at all the different layers. And one more thing on my soapbox, I saw the question up there earlier from Marco that said, what are ways to embed CHWs into a larger network that provides structure and also creates accountability for institutions and organizations to their clients and communities? This is how you're doing it. We're talking about CHWs and y'all, I'm saying y'all, the folks here at the network, you go back to your organizations. You look at how you're treating your CHWs. You look at your policies. That's how we can continue to hold ourselves accountable and actually work towards institutional systemic change. Go back to where you're going, like to who you work for. and take a look at how you're treating your CHWs, or even if you have folks who qualify for that role. So it's like, this is how we're doing it. So congrats, we're doing the work. I'm off now. All right, bye, everybody.
Thank you so much for sharing that. And this idea of whether it's something of benefit to the CHW and whether the sustainability option is there in the first place to be an option. So I appreciate your sharing. I think Keiko, you had your hand up first, and then Jessica would also like to share.
Yeah, such a brilliant discussion. Thank you. I'm just learning so much. In our group, we spent quite a bit of time talking about kind of Noam Chomsky actually, and his ideas around sort of invisible framing and kind of the hegemony of what we consider common sense. And so solution, like, so it's sort of a way of containing energy for the benefit of systems as they exist now. And I think one of the challenges is to just kind of reject that framing, and which will allow us to expand what we believe is possible. And so that invisible framing is constantly with us, sort of as it's kind of a pressure valve, just a way of dissipating energy by concentrating it in one area, but only providing, a certain framework for solutions that could arise. So yeah, it seems like this is an area where, as Ara says, there's so much connected to it. And we keep thinking, well, we can only provide solutions in this way, but really that larger dreaming is what's necessary for liberation.
Awesome. Thank you for sharing that. Jessica?
Thank you. I just really appreciate this conversation, and it has my wheels turning. And in our group, we talked a lot about the vital role that the community health workers we know play in the work that we do and in the communities that are being served. And one of the things that struck us is that it's not often the roles are not well funded, and the work they're doing and the things that the community members need are not getting funded. And I think part of that has to do with the systems that we're working in, as we know, but these systems we're trying to work against them, right? We're trying to change them. We're trying to shift things. And that's a big heavyweight. And you really got to get like everybody on board thinking and talking and understanding it. And from what I was hearing, especially from Daniela, was that, often often community health workers just aren't being heard by the medical professionals. And if they're not being honored for the wisdom that they bring about the cultures that they're serving and the community members' needs, then there's just going to be a lot of confusion and a lot of hurt and a lot of gummed up process. So, I think this is the work. Yes, totally agree, Ara. I just would say also we need to get medical professionals trained on how to work well with the wonderful and knowledgeable and caring work that community health workers are doing, so that when a community health worker comes in, even if they're not in their practice, they know this is a person I need to respect. If they say something, it's coming from a very real place. And, it's going to make my job easier. It's going to make the work I do better. It's going to make the results I get from the care I'm offering better. And we can hopefully not just be recreating trauma after trauma, for people who are already navigating so much. So, yeah.
I appreciate that. Definitely. How do we self-advocate and educate all of us, including healthcare providers, and how do we incorporate CHWs into what we call the care coordination team to be valued, such as the provider, and saying, hey, there's also this other comprehensive that we need to take a look at around these 7 vital conditions that are affecting the care that you're providing, your care plan. So really appreciate your pointing that out. Devin, I think you have your hand up. Yeah.
Yeah, it's me again, sorry. I think one of the things that is really hard is just the different tracks of training. So I'm in a program right now that's for a doctorate of nursing practice and a master of public health. This public health business, we get none of this in training, like unless you choose to. So there's like this whole world of community health and public health that's happening that we don't know the language, we don't know the roles, we don't know these titles. And when folks come in to see us in a clinic visit or even at the hospital, we have to be very careful about what we're saying and who we're saying it in front of and getting permission. If you're translating, if there's a language barrier between me and the patient and I can't ask them, is it okay if I, divulge this information, especially with certain protected diagnoses in front of this person? I can totally see how it can be perceived as disrespect, but we're trained that like our allegiance, our focus is the patient. And so these different relationships and different roles are really hard to try to understand in the moment of providing care. But I don't think it's impossible. I think it's simply one of those things that we just need to be made aware of. There are these people who may be coming to appointments and this is their role and this is, how we utilize them. I don't think it has to be such a terribly big hurdle, but it is something that is unknown, just widely unknown. And the last thing I'll say, we have code whites in the ER all the time. And that's when there's so many people in the waiting room that any nurse or any available clinical staff is asked to come to the waiting room and kind of triage these people and help prioritize who needs to be seen. What a gift it would be to have community health workers in that space to be able to help with some of that translation and bridging. You don't have to incur this thousands of dollars of bill. You just need some health system navigation assistance or need to know where to go for what kind of a thing. So I think there's a huge opportunity, but I'll stop talking. Thanks.
No, thank you. Thank you for sharing that perspective. And I appreciate you looking into what are the ways in which you can collaborate with community health workers and bridging that gap in the relationship and how to find community health workers, acknowledging them, incorporate them, and also be thinking about what are the ways that the sustainability of fairly compensating community health workers that in many times volunteer their work, how to fairly compensate and incorporate them into these fair compensation methods in order to make sure that they are feeling valued, not just as an individual with dignity and respect and valued for what they bring and what they do and how they work on the health outcomes of people, but also how can we value them in a fair compensation way in our sustainability of Medicaid reimbursements, of care managed organizations, how do we embed them into these fee-for-service type of things so that they become part of that care coordination, part of that justified way of providing a service that's comprehensive that will lead to better health outcomes and HEDIS measures and et cetera. So I appreciate you bringing that out and starting to think about that as well. Anyone else? Jackie, yeah.
Awesome, thank you, Mario. I really am appreciating the rich conversation. I think just to build off what Devin and you, Juan, are sharing, Mario, is like, I think it's happening here, like, right? I think folks' imagination is being expanded of what that looks like. I think that we are being mindful of what areas need more care and consideration. And I think that one, like when to answer your question specifically, like, right, how do we? I think we set up that structure. We set up that structure that doesn't force individuals to blend in that system, but rather complement that system. And so I think, right, it's going to take some time and space, but I think that, without, shifting services and how we do this work and how we come to this work, we're not going to want to get ahead. And I think so many things in terms of, I appreciate everybody when sharing. One of the things we talked about in our breakout room, and I invite folks to join, right, to share. One of the things we talked about is, one, not only the challenges, but in naming those challenges was that, you know, it's often constantly at the lending and bending of our backs, right? To be a bridge, but nobody ever really pauses to say, well, does the bridge need maintenance, right? I don't know if you're all familiar with West Seattle Bridge, but in COVID, like, it was so bad, it shut down, right? It would have shut down if there was a pandemic or not a pandemic, because there wasn't proper maintenance on that bridge. And so I think that there are areas, again, that, right, we can like pause and reflect and lean into as we are invested in and committed to building healing-centered engagement practices that are responsive to community care-based solutions. And so I appreciate the conversation. Thank you.
Thank you for sharing that. Yeah, absolutely. How do we look at the maintenance of those relationships? How do we build those relationships and also maintain them? And how do we better it? What's the new reiteration? What's the new next generation of what this could look like, and reimagining how these things could actually work to the best of the partnerships, of the relationships, and in general, the community. So I appreciate you sharing that. So there's a question that was asked in chat from before. It said, do community health workers assist in helping access other resources related to vital conditions like food and housing, and how do you stay informed about that ever-changing landscape? And I think this was Mike who brought this up, and absolutely, community health workers do work on the 7 vital conditions of housing. In fact, that's a lot of the things that community health workers do, and they because we are embedded in the community, because we are come from community, because we look like community, we are on the lookout on how do we look for housing, how do we look for rental assistance, what's the best, is there a new transportation program that provides gas cards, or that provides a new rental assistance program for those that were affected and are no longer, or that are now eligible that were not eligible before. It's always looking for resources all the time, and actually checking in and making sure that a phone number does work, that referral is going to be working, and you're actually talking to people, making those connections with people to make sure that there's that accountability. As a community health worker, we face the community. And so if I say, you know, let's take you to this program, and that program doesn't exist, then I'm accountable to community. I'm supposed to be the trusted messenger. I didn't tell you something. So we are worried about that. We're passionate about that. We just want to make sure that when people have an urgent need, it's our urgent need as well. And we want to make sure that that urgent need gets met, whether that be rental assistance, transportation, getting a ride to Seattle, you know, getting emergency food, whatever it is, all those things, making sure that urgent need is also urgent for us, because we've been in that situation, we've lived that experience, and we feel it, and we have that accountability to you. I'll say that when my mother first came to this country, she had 5 kiddos, and she worked by herself. We didn't know any English. We didn't know the healthcare system. She worked 3 jobs. She worked at 3 different flea markets just to get food on the table, just to pay the bills. And we didn't know any of the resources. We didn't know English. We didn't know any of that stuff. And if we had a community health worker that we could go and trust and say, hey, you know, how do I do this? How do I do that? That would have been very helpful. And so removing those barriers for the next generations of connecting people to resources, to education, to rental assistance, to not being in debt, to getting good credit, to all these things that make us more sustainable and also connected to community. That's what community health workers do. And we face the community, we're accountable to community, we are in the community, and that's what's special about it, because we are the face of community, and we're interacting with your resources because we want to share, and we want to make sure that lived experience is better for all of us that are living this generation, but also next generations, making sure that gets reimagined into something that's better and that's more that leads to progress and leads to a hopeful sustainability model for everyone. So kind of feel like I'm talking more, but anywho, any other thoughts that you might have? Any final thoughts here?
Daniel raised his hand. Go ahead.
Thank you. I wrote down, so Mario, don't worry. People that know me know you ask me what time it is, I'll tell you how to build a clock, so I can go on and on. But I wrote my points down. I think hearing like burnout, things like that, the frustration, we were talking about the structures of, and Noam Chomsky having this lively debate still within a very restrictive space. We're asked as people that are put in a professional position to talk to communities that are about communal engagement. And then we're put on a clock. That's contrary. That is in conflict with the task that's laid out. So then you have communities that are dealing with racism and may not have seen racism or the historical structures. So I think cross-cultural engagement is very important. People that have lived this trauma, this oppression, and know the dynamics of it, because let's be honest, people of color in America that have had history in America know the structure, know the dance, know what to expect next. And with civic engagement, building capacity in your community. I was told a long time ago as a parent advocate that if you're not at the table, you might be on the menu. So learn how to show up. You don't have to be the expert, just be in the room, the knowledge will come eventually. So not only doing for a community, but in building capacity in the community to do for itself as well. And I've heard it said that the job of a leader is to create other leaders. So that's kind of my points real quick on that. So thank you. This has been a great conversation today too.
Thank you so much, Daniel. I really appreciate that.
Guillermina, the last as I was hearing from folks, the need, the burnout, but also for me, what I'm hearing is the Maslow hierarchy of need, the triangle. That's just very always, as a community health worker, I feel like they're doing that Maslow hierarchy of need, but it could be challenged because Skagit County is negative. Is it negative 1% vacancy? There's hardly anything. With that, rental is also very high. When community health workers go and help them, it could be stressful. It needs to be done more. It needs to be, we need this to be stable. We need this to not just to be, they're doing this. It needs to be, they need to have more people that could speak people's languages, could be able to integrate and be the friend to help them out. Not only the bridge, yes, it is a bridge, but how that bridge is gonna go towards them and not halfway. Because you don't leave people on the very half of the bridge. We really want to walk them to the end of the bridge.
Yeah.
So
no, I appreciate that. That definitely meeting people where they are and talking about their needs and how do we build around those 7 vital conditions so that they are being able to live healthy, thriving lives. So I really appreciate that. This is really great discussion. Really appreciate everyone's insight into how do we create opportunities for community health workers and incorporate them and start to value them and see how we can collaborate together in order to make sure that our communities are living well and are sustainable, and we have a hopeful future for all of us, for our next generations, and for honoring our ancestors, and making sure that all of us, all our family members, from old to young, are able to live successful lives and happy lives. And I wanted to share with you just very quickly, kind of what the future, what are some of the things that are going on around community health work right now, some of the challenges and opportunities here. There's talk at the state level and also at the national level about whether do we certify community health workers or do we not certify? What are the benefits of certification versus no certification? That's one of the conversations that's happening. Also, Medicaid reimbursement. How do we sustain community health workers? There's Medicaid dollars that might be able to provide sustainability for community health workers to provide some basic types of care, such as education, resource sharing, advocacy, things like that. And we're in the stages of finding out with the healthcare authority in Washington State, how do we provide Medicaid reimbursement on those things? So if you want to find out more about community health workers being involved, as Daniel talked, showing up and being involved, we can definitely invite you to some of the local resources that we will be sharing with you all in the chat box. Well, oh, am I back?
You're back.
Okay, sorry about that. So there's the Washington Community Health Worker Network that's available. And we'd happy to have you join us and we can find out about resources that are available. There's also there's a lot of trainings that the Department of Health is providing on the different, Meg provided the information there if you want to get on the list for that network. There's also Department of Health training that you can attend, and we can go ahead and put the link in there so you can see when the next available training is. It's not a certification, but it's a great start, and it's lots of great information. Also, you can find out about NACHWA, C3 Project, etc. All those resources will be shared out with you. And also, I would like to make a plug-in for the North Sound ACH is going to be hosting a community health networking gathering on September 30th. So if you are a community health worker or a supervisor of a community health worker, please, if you could put your email in the chat, and if you'd like to learn more, you can also email team@northsoundach.org, and that is going to be a great space for community health workers to learn more about how to find resources, how do we work, how do we outreach, how do we self-advocate, how do we provide value, how do we build that bridge and collaborate with each other. And I think I'll leave it at that because we're a little bit short on time. But thank you so much for this awesome opportunity to share this with you.
Thank you, everyone. Today was wonderful to meet many of you. It was having great conversations. I appreciate your time and for joining our learning session today. I'll pass it over to Megan.
Hi. Sorry, I'm looking at I don't know where my camera is. Hello, everyone. So I'm Meg. I'm at North Sound ACH, the communications director, and just wanted to close us out with our usual resources. So we will be sharing all the resources we've shared, plus we have so many more that our panelists gave us and that have been collected. We're going to be putting it on here on our resource library, and we will be emailing out the link once everything is uploaded. It will be attached to the recording session for this, as well as the slide deck. And so you're going to be able to see everything all at once. And we also encourage you, of course, to check out the rest of our resource library, and please contribute to it. If you are like, wow, this has a lot of really great stuff, but I know what could make it better, please send it on over. We've got on the resource library is a suggest a resource. You can also email us. I mean, we're easy. We just want to collect your wonderful information. So we'll be emailing that out to everyone. And then we also have a survey that we would love if you can take. We love having your feedback from these learning sessions so that we can continue to make them better. So we'll put that link in the chat for you. If you could please take a couple minutes today, tomorrow to fill out that survey for us. And then I think the last, besides our very excited about our community health worker gathering coming up, before that, we will have our August partner convening. It'll be a one-day convening in person, open to all of our network members, and it is open to community members who want to come and join us. That's going to be at the Swinomish Casino on August 16th. We sent out the email with the registration, but we're going to put it in here as well. And always email us at this team if you ever have any questions, or you just like, I misplaced this link. We're happy to send it on over. So we've got a couple events coming up. We've got our August convening on the August 16th. Our next learning session will also be in September. And that will be on September 20th. We'll also continue to send out save the dates. And then our community health worker convening for community health workers and their supervisors and allies. It'll really be a CHW focused gathering. That's going to be on September 30th. And then I'll save the rest of the fall for later because that's already a lot going on. So thank you all so much for your time. Thank you to our panelists for being here, Michelle, Katherine, and Daniela. Thank you so much. And all of you for being here. Appreciate your time.